Are you also getting fillers to hide your eye bags and still dissatisfied with the results? Or you're suffering with eyelid aging and want a solution which is lasting? Then you need to watch this video. I am Dr. Shilpi Pudani. I am a plastic and aesthetic surgeon at SB Aesthetics, Gurugram, India. Eyelid aging is an increasing concern in the Middle Ages, and we do different things to combat this, either botulinum toxin to raise our eyebrows, or maybe fillers to hide our under eye bags or to fill our under eye hollows. But is it enough? And is it enough for a long time? This we need to know. Anti-aging eyelid surgeries are a set of surgeries which rejuvenate this entire area that you see. And this is a concern in a lot of people who have under eye bags or droopy eyebrows or even this upper eyelid sagging. What we can achieve through periorbital anti-aging results can really make a remarkable difference to how you look, how awake you look and how fresh you look. So coming to the first procedure, that is under eye bag surgery. So when we have this fat bag pouting out and we fill this area to hide this bag, over time the filler accumulates in this area and later on it leads to a puffy look and a not so fresh look, I would say. So what is the solution? The right solution for the under eye bag is definitely lower blepharoplasty. This blepharoplasty can be done by two methods. Either we can take out this fat which is pouting out from inside the eyelid and it leaves no scar, and we can augment this lower area in which fat has reduced with fat grafting, again without any scar. So fat bag removal through this transconjunctival blepharoplasty along with fat grafting of this area is a great combination to make you look more awake and fresh. Now coming to the other method of lower eyelid surgery, which is through the outside. Now if we have a lot of sagging over here and the skin is really loose, then we need to go from outside just under the lash line, and again the scar is that you and your doctor need to make. Now coming to the upper eyelid surgeries. Now upper eyelid, again this decision about having an upper blepharoplasty alone or with a brow lift is a decision that you want. Now coming to the upper eyelid surgeries. Now upper eyelid drooping is again a very common concern, and we address this very commonly with an upper blepharoplasty. It's a short surgery done under local anesthesia, and this excess skin that you have here can be removed and the eyelid can be tightened. However, if you are suffering from brow ptosis along with this upper eyelid droopiness, then you need to get a brow lift along with it. Now whether you choose to do this together or separately is your decision, and you can talk to your surgeon about it. But if we do it together, then of course the result is definitely much better. But we need to see whether how much of correction can be done only from the eyelid surgery, because a lot of times we see that this brow is drooping and causing an excess skin look on the upper eyelid. So obviously when we are talking about the upper blepharoplasty, then we also need to understand that this part, the inside of the eye, sometimes it has a fat bag, and that can also be addressed during this eyelid surgery itself. So you don't need a separate surgery for this eye bag removal. So all in all, when we talk about this periorbital rejuvenation, a lower eyelid surgery, whether it is transconjunctival or transcutaneous, that is through the skin, an upper blepharoplasty and a brow lift, it's a great combination actually, and I often combine this with a fat transfer on this area, because with age what happens is that this area loses fat and gradually we see that all this skin, the excess skin that is created by this loss of fat is actually accumulating in this area. So fat transfer is a great addition and a very good anti-aging procedure along with these periorbital rejuvenation surgeries. What I would definitely recommend though after the blepharoplasties also is that you can definitely keep doing botulinum toxin around this area and this forehead area or the frown line area to have the anti-wrinkle effect continued, so that the aging can also not progress so rapidly after the surgery is done. So I hope that this video will help you in deciding whether you want a temporary method to hide your eye bags like fillers, or a more permanent solution like a blepharoplasty to get rid of it for a long time. If you like the information in the video, do share it with your friends and do subscribe to our channel SB Aesthetics and keep the notification bell on so that you can get notification for the new videos. Thank you for watching.